Breast cancer. What's going on, Secoya Nation? Dr. Schilling bringing you today's wellness wisdom, and we're going to touch a subject here that's sensitive and delicate. And we always want to preface this with, remember, we're not diagnosing anything. We're not telling you what's wrong with you. We're just telling you what you could consider as what led to a condition that you or someone you love might be dealing with. So, give you a backstory. We had a participant come to the clinic, and she had been dealing with some lumps and things like that she had been finding, and she went the traditional medical route. Turns out that she decided to follow the instructions of getting a radical mastectomy, bilateral. It means removing both breast tissues, and she had reconstruction, which means she had some artificial aftermarket parts put in afterward. So she felt, normal again, because if you do a double mastectomy, you're going to look like me and not like a woman, typically. So if you get this kind of diagnosis, it's always good to take a pause, take a breath, and say, okay, I need to take this information and study it, understand it, before I go taking some type of drastic action and some type of, holy crap, I got to go do the whole 9 yards and chemo and radiation and surgeries and reconstruction, stuff like that. So if this is something that you're feeling like you need guidance with, or someone you know, and they want a natural perspective in terms of what can help, because we work with people like Sherry and the Haleys and stuff like that. These people have come to us looking for support. We don't cure people, we help you heal yourself. So we'll give you the tools, so keep that in mind before you step in it like, someone's going to cure me. No, there's nothing wrong with you. You don't need a cure. You have to address what led up to the situation in the first place, because this body, your body, does not make mistakes. Does not make mistakes. If it's happening for a reason. Your body's trying to heal something. Use that as fuel to understand. So, where were we? Cancer. Like, it's thought to be like an invasive cell, like these attackers from the outside, and you've got to cut them out because they're not part of you, or they used to be part of you, but they're not you anymore, and things like that. That's a medical model that says this is the bad thing, we cut it out, you're healed. But if you look at the survival rates, right? Not like quality of life rating, but the survivability of each one of these, whether it's ductal or glandular or lobular, whether it's invasive or non-invasive and stuff like that, they have these survivability scales. Like within certain people live like 20% of people live this long after 5 years. Like, holy crap. I mean, what does that mean for your quality of life? I mean, once you get a mastectomy, there's a self-evaluation conflict where you see yourself as less than, even if you have reconstruction surgery. So this is not something to take lightly. There's things like BRCA genes. People are like, do I have the BRCA gene? If you don't know who Bruce Lipton is, he was a stem cell researcher back in the 60s, and he has determined that basically less than 1% of disease on the planet is actually genetic. We want to blame that because we want to say there's something wrong with us, or we want to say, here, I can tell you right now why you have something, and this is the cause. Instead of saying, what choices did I make in my life? What stresses have I encountered? What traumas have I experienced that are leading to this? Because if less than 1% of disease is genetic, then you really don't want to fall back on BRCA and be like Angelina Jolie, who went and preventatively, had a double mastectomy because she had a BRCA gene, or 2 or 3, whichever she had. Before we get talking about the environment, because toxicity, right, either emotional toxicity or, estrogen toxins in the environment. There's so many to even talk about. There's water, air, food, lotions, things like that, perfumes. All these things are toxins, and if they don't get out of your body, they typically store in your fat. Breast tissue is a lot of fat tissue. There's glands and ducts in there, stuff like that, but the toxins get trapped in the fat tissues, and that can be toxic over time. But instead of thinking about that, let's talk about why we're really here, which is how does the conflict in the mind develop into an issue in the tissue, okay? Because the breast is basically a nest worry. Like the women nurture their children with their breast, okay? So a nest worry is related to how can I nurture my family, or how can I not nurture myself, if you will, and that's what all ties back into the breast tissue, okay? So oftentimes there's a separation, like, let's say, for example, when Sarah had an emergency C-section with Sammy, and he was, quote-unquote, torn from the breast, like he was taken away from her, that can create a conflict in her in terms of a separation conflict. It can also be a danger conflict, because there's danger for the child, there's danger for, let's say, a mother is separated from their child from college, or at college, and they're having this worry over their children. They can literally develop fibrocystic tissues, glandular issues, lobular issues based on their fear, their worry, their separation from their child, or something like that. So those are just some ideas when they can't get in touch with their kids or with their loved ones, whether it be the spouse, children, people like that. It can develop from women's feel like their families are bursting apart, like there's conflict and turmoil in the family, and the family's bursting apart, like it's falling apart, and the mother feels the responsibility to be the nurturer and bring it all in, bring it back in. That stress in her life, in her mind, can create an issue in her tissue in her breast. Okay. Typically, we think of breast as like strife. So bitter disagreements over fundamental issues is a big opportunity for anyone, male or female. Males, it typically affects the prostate with struggles, but women, it affects the breast when there's bitter disagreements over fundamental issues. That's called strife. But worrying, constant worrying, being a worrywart. Worrying is like praying for bad things to happen. So keep in mind how worries affect the breast, because if it's worrying about your kids, worrying about yourself, worrying about your health, worrying about whatever it is, it can definitely affect your body over the long term. If you have an overly authoritative mother, like a dominant mother figure that doesn't allow you to live your own life and sort of nurture your own family, she's always in your business, stuff like that, that can affect your breast tissue. And what else? Let's say, a mother had repaired her family structure, but then all of a sudden another divisive, let's say she had cancer. Remember, that's just a diagnosis. Don't pay attention to the diagnosis, just as people identify with the diagnosis. So she had dancer, we'll call it dancer, that's what we call it here. And that resolved because somehow the family mended its ways. And then all of a sudden there was another explosion, another violent altercation, another discourse in the family where no one is really engaged, or they're just being really divisive. So the family explodes again. Then she has another tumor, maybe on the opposite breast, depending on who it was in her family. If it's the husband on the dominant side, the children on the non-dominant side. It just depends, because how your brain sees your body is determined by who is in the role. So we could get really granular about this, but we're not going to go that far because it's not that important. Understanding, like, if you feel like your family's bursting apart, whether it's yours or your mother's or whoever it is, it can affect your breast. Okay. Feeling like a fear of not being able to have a home, or feeling it impossible to have a home, as another opportunity to think about how that will affect. Remember, again, the breasts are about the nest. So it's anything that's related to the home, related to the home life, related to the nest and the family and things like that, it's going to affect the breast tissue. In the off chance there's feeling guilt about having a desire for another man that's outside of your relationship, that can also affect. Or I suppose in everyday's modern world, it could be a woman. Because everybody's have different persuasions. So whether you're having a desire for a man or a woman outside of your relationship, that can determine, or that can have an adverse effect on your mind, which then can show up in the breast tissue. So those are some kind of themes as far as, how these things can show up in your body. I present these to you for your consideration, not for your thinking it's gospel, because not all of this is going to be relevant to you or your loved one, but it's helpful for you to understand like how these different themes tie together, and then how you can go ahead and approach them. If you find these valuable, please like it, share it, send it to one of your friends and family that's dealing with something like this. There's all kinds of themes. We focused a lot on ductal. There's a little bit of glandular mixed in here, but a lot of this is ductal. It just depends on how, we don't have all night to talk about this, but I just want to give you some thought-provoking ideas on how you can challenge your beliefs about what the cause is, and rather than thinking it's the tissue that's the issue, think about where's the conflict that resulted in the issue in the tissue. Because it's over time when there's stress, toxicity, lack of nutrients and things like that, and the disconnect between the brain and body, the mind and body, is what causes this to happen. So check out the YouTube channel, find other videos, do a search. I try to do at least 4 of these a week so you can be empowered. But we'd love to know what you want to hear about, what you want to learn about. We thank Yvette, big shout out to Yvette for bringing this to our attention again. It just gives us fuel to provide you value. So we're here to serve you and here to elevate your awareness and help you spread the word that people can stop chasing the diagnosis, that they can ditch the diagnosis and then feel better about that their body's not broken, that their body doesn't make mistakes, and that they have the opportunity to heal their body via their mind. Okay, guys? There's more to this, clearly. It's not about just fix your mind, fix your breast, but that's got to start there. Because if you haven't had an injury to your breast, it's coming from the brain down. Okay, guys? All right. With that, we'll sign off for the night. Have a great night. We'll see you tomorrow. Bye.